Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Dr. Matt Dybel, the Medical Director of the Covenant Emergency Care Center. Thank you so much for joining us, Doctor.
Thanks for having me.
You're welcome. Okay, so today we're talking about the latest trends that you're seeing at the Emergency Care Center. So what have you seen the last few months, Doctor?
Well, if you go back the last few months, you can suspect that with this pandemic hitting, that we did start seeing some patients with COVID-19. Interestingly, at that same time that started, we thought we would become very busy, but actually the opposite happened, where people became so nervous about getting care, even emergency care, that a lot of people stopped coming to the hospital, including to the emergency department. I think nationwide you heard there's about a 45% decrease in emergency department visits, and that was true here in this region also.
And what do you want people to know about that, Doctor? What do you want people to know about seeking emergency care, how important it is, even if it's not, even in pandemic time? Yeah.
Yes. My goodness, it is so important. So what we saw during that time, unfortunately, is people who had delayed care to the point where they came in and they were much, much sicker than they otherwise would have been, resulting in having to be hospitalized longer. We've even seen an increase in some deaths at home than we normally see. So fortunately, we're trending in the right direction. We see very few patients now with COVID-19. And the vast majority of patients are starting to come back again and feeling more comfortable with getting their care in the emergency department.
Great. You know, Doctor, what precautions is Covenant taking at the emergency department, taking to make sure that your patients are safe when they return there?
Lots of precautions. And as you've mentioned before in the medical moment, we were recently recognized nationally, again, for our safety with an A rating. So what we do specifically is, as everybody comes in, they are given a mask. If they don't already have one, we encourage you to bring your own just to spare supplies. But if you do not have one, we will give you a mask. There's a hand washing station right as you walk in. You are screened to make sure that obviously if you have symptoms, we're going to see you. But if you are bringing somebody with you and you can have, instead of our usual 2 to decrease traffic, where you're allowed 1 healthy visitor, we'll screen the healthy visitor, make sure they don't have symptoms. And then as you come back into the emergency department, you'll notice the waiting room, it's pretty much always empty right now. We're able to get people right back. And then as you go to a room, you're in a private room. If you think about it, when you go to public places, not everybody's wearing masks. You're not in private rooms. It's actually a pretty safe place to be in the emergency department, given everything that we're doing.
So if people think that they have an urgent medical need, what should they do, Doctor? Please.
Come into the emergency department if you feel like you need to. If you are unsure, then please give your doctor a call, and your doctor will help guide you. They will be able to tell you if you need to be coming to the emergency department or maybe to a Med Express, or you can wait till the office later on. But I would say, generally speaking, lately, people are foregoing that emergency care when they really need it, particularly with things like chest pain or severe abdominal pain, things like that, please, or even any kind of potential stroke symptoms. Come in and get that emergency care that you need.
Well, we know that Michigan is starting to open back up. So with that happening, what do we need to know to prevent the spread of COVID-19, Doctor?
I'm a pretty optimistic guy, and I would love to think it's just gone. But the reality is there are still a few cases out there in our community. And because you can't always tell who has it, we really need to keep doing those things that just are not very much fun. And that is the social distancing, wearing masks in public places, enclosed public places, making sure you have your mask on, and then good hand hygiene on a regular basis. And those things will keep you safe, and will also keep your loved ones around you safe.
Anything else you'd like to add, Doctor, that we haven't covered?
Well, again, I just appreciate all the caregivers, all the essential workers that have been just doing so much during this pandemic. From the bottom of my heart, I am so grateful, and also grateful to the community and everything the community's done to step up and help. It is so very much appreciated, so thank you.
We do appreciate it too. Thank you to all the workers, and to yourself, Doctor, as well. We thank you.
Thank you so much.
Okay, now if you have any other questions or you would like any other information, please head on over to the Hot Links page on WNEM.com.